Postpartum psychosis, what every mom, dad, and family needs to know. Bringing home a new baby is often described as one of the happiest times in life. But for some families, the days and weeks after birth can include unexpected mental health challenges. One of the most serious and least talked about conditions is postpartum psychosis. This article is for mothers, fathers, partners, and families, so you can recognize the signs early and know when to get help. What is postpartum psychosis? Postpartum psychosis is a rare but severe mental health emergency that can happen after childbirth, usually within the first 2 weeks after delivery, sometimes within days. It causes a mother to lose contact with reality and may involve hallucinations, delusions, or extreme mood changes. Without treatment, it can put both the mother and baby at risk, but with treatment, most women recover fully. Why does it happen? There is no single cause. It is usually a combination of hormone changes. After delivery, estrogen and progesterone levels drop rapidly. This sudden shift affects brain chemistry, sleep deprivation. Lack of sleep is one of the biggest triggers. Going days without rest can worsen mental instability. Mental health history. The strongest risk factor is a history of bipolar disorder, previous postpartum psychosis, schizophrenia, or schizoaffective disorder, or a family history of bipolar disorder. Physical stress or medical conditions. Childbirth is physically demanding. Complications, infections, or metabolic changes can contribute. First pregnancy. First-time mothers have a higher risk. Can infections or STIs cause it?
Yes. Sometimes. While most postpartum psychosis is related to hormonal and psychiatric factors, certain infections can trigger symptoms or make them worse.
Important examples include severe postpartum infections, uterus, urinary tract, wound infections, HIV, and untreated syphilis, neurosyphilis, which can affect the brain and cause psychiatric symptoms. Doctors usually check labs to rule out these medical causes. Symptoms to watch for. Symptoms often start suddenly and may worsen quickly. Mental and emotional changes can include severe mood swings, confusion or disorientation, extreme anxiety or agitation, depression or mania, and not sleeping for days. Psychotic symptoms may include hearing voices, seeing things that aren't there, believing things that are not true, paranoia, religious or grandiose beliefs, or thinking the baby is in danger or not real. Behavioral changes include acting strangely or out of character, poor judgment, withdrawal from the baby, restlessness, or pacing. Get immediate medical help if a mother talks about harming herself or the baby, is hallucinating, is extremely confused, has not slept for several days, acts paranoid or disconnected from reality, shows sudden personality changes. This is not something that can wait. Call emergency services or go to the nearest ER. How is it treated? Postpartum psychosis is treatable and recovery is very possible. Most women need hospital care at first for safety and stabilization. Treatment may include medications, antipsychotic medications, mood stabilizers such as lithium, medications for sleep or anxiety, sleep restoration. Sleep is critical for brain recovery, therapy and support. Family involvement improves recovery. Electroconvulsive therapy, ECT. In severe cases, this treatment can work quickly and safely. What tests will doctors do? Doctors often run tests to rule out medical causes. Blood count, CBC. Electrolytes and organ function, CMP. Thyroid tests, infection screening, STI testing such as syphilis or HIV when appropriate. Urine testing, sometimes brain imaging. These tests help make sure symptoms are not caused by another illness. What is the outlook? With treatment, most mothers recover fully. Improvement often occurs within weeks. Many return to normal functioning without treatment. Risk of suicide increases. Risk of harm to the baby increases. Future pregnancies may carry risk, but preventive planning can help. Partners are often the first to notice changes. If something feels off, trust your instincts. This is not the mother's fault. It is a medical condition, just like high blood pressure or diabetes, and it needs medical care. Your support can save lives. When to seek help immediately. Do not wait if you notice hallucinations, delusions, severe insomnia, confusion, or safety concerns. Emergency care is the right step. You are not alone. Postpartum psychosis is rare, but families who experience it often feel scared and isolated. With treatment, support, and time, recovery is possible. If you or someone you love may be experiencing symptoms, reach out to a healthcare professional right away. Help is available and healing can happen